Hello, everyone. Thank you so much for allowing me the opportunity to present this quick presentation. My name is James Baldes, and I want to talk to you about the discussion topic for the week, which is the bridge between bioethics and public health ethics. Just a quick overview of the correlation concepts between them both. Understanding, of course, its core, which is ethics itself. A lot of the terms that I'm going to be discussing in this presentation are very well familiar to all of us. Therefore, I will not be spending too much time on them as our presentation time is very limited. Ethics basically simplifies to the fact of acting on moral values. That is just understanding that we have right decisions to make on the basis that there are wrong decisions to be made. Understanding ethics and understanding right or wrong, it provides us with the opportunity of creating a framework, as we can see here, for evaluating the ethical implications of actions, especially in fields like the ones that we work with, which is healthcare. Now, in healthcare, ethics plays a really important role. It allows practitioners such as ourselves to be able to make informed decisions and scientific based decisions for our patients while also providing them the benefit of autonomy, which is basically allowing them to be able to make decisions for themselves and advocating for themselves, while also providing beneficence, which is looking out for the well being of our patients and ultimately as well do justice by them by doing no harm and thus increasing the public trust and enhancing the quality of our care and the results that we are to be receiving. Bioethics basically forms on the basis of that. It's just the relation between the ethical moral values and how it applies to the healthcare field. And it examines the ethical implications of biological and medical procedures, technologies, and treatments in all the patient treatments that we do in the healthcare field. It doesn't matter which field you're working on, bioethics applies to it all when it comes down to healthcare. And understanding this is understanding its principles: autonomy, allowing the patients to be able to make informed choices about their own healthcare; following through with beneficence, the obligation to be able to act in the best interest of our patients; as well as non-maleficence, do no harm. You have to weigh the risks versus the benefits or the benefits versus the risks. Also, as well, understanding that we must always act with justice, equal rights, equal access, and equal fairness for everyone. This allows us to address disparities between the different populations while advocating and achieving mutually equal justice for everyone. This being understood, we understand that bioethics just plays a huge part on what it is individual patient rights and understanding that they have rights to be able to make choices for themselves and their care. Now, when we talk about public health ethics, it focuses on population based rights. While it does take into account bioethical rights or basically rights as an individual patient, but public health ethics focuses more on the principles of delivering health services to communities, while also understanding that there is a tension between individual rights but the responsibility that public health personnel has to be able to make ethical and responsible decisions for the community or for their collectiveness. It aims to protect and improve the health of populations while addressing social determinants. Now, the key principles: population health by interdependence, understanding that communities depend on one another to understand their struggles so that they're able to make informed choices that benefits everyone; prevention by allowing the participation of the community and also emphasizing proactive health by providing the community scientific based evidence that allows them to be able to make informed choices about their care. Now, jumping into this, as we said before, public health ethic guides the community to health initiatives by addressing ethical challenges in policies such as vaccination programs and health campaigns and such. And it requires a really good balance between the bioethical boundaries as well as the public health initiatives themselves. Now, going into this, the differences between bioethics and public health ethics are basically focused, as I said before, on individual rights and the moral dilemmas in healthcare versus the public health ethics that emphasizes the collective well-being of populations. So it all affects just decision-making process, emphasizing on the fact that patients have the right to be able to care for themselves and provide decisions for themselves versus the communities being able to make decisions as a whole for all the patients. And this is how we are able to relate our health issue, which is I chose a very controversial topic, which is COVID-19. It exemplifies a perfect intersection between bioethics and public health ethics by highlighting critical moral issues in the healthcare decision making process. What do I mean by this? We basically, during COVID, didn't really have a voice, okay? There was no such thing as prerogative, there was no such thing as liberty or bioethical boundaries. Personal choices were taken away from everyone, whereas imposition was being practiced basically by public health entities, imposing mandatory masks, mandatory vaccine, mandatory lockdowns, curfews, and travel. Basically, if you didn't comply with the rules and regulation, you would either get in trouble with the law or you would just cease to have the existence of a normal human life. And just by analyzing this briefly, due to our time, this basically is the way that public health practices or public health ethics correlates to bioethics themselves. One focuses on individual principles while the other one focuses on collective community principles. However, one or the other does not disregard one another, which is why extremely important to understand that both are equally essential in addressing contemporary health issues such as COVID-19 or any other issues that may arise. Which bears the question as to how will we handle another situation like the COVID-19 crisis in the near future. And that is for you and for me to figure it out. And that is what we're here to learn in this class and in this wonderful master's that we're currently pursuing. Thank you so much for allowing me the opportunity to present my content. Thank you.